Ladies and gentlemen, Gustav Henriksson. Welcome to this 20th anniversary of the European Centre for Disease Prevention and Control. A very European introduction and a very European moment, bringing people together from all across Europe. My name's Nick Fahey from Round Europe, and I will be your moderator for today. And our introduction for today's event will be given by the director of the centre, Pamela Rendi-Wagner. Please join me in welcoming her to the stage.
Well, hello, everybody. The Commissioner, Minister, Director General, Directors, dear Andrea and Mark, dear Geza, Excellencies, distinguished guests and friends of ECDC. On behalf of ECDC staff, I'm extremely delighted to welcome you to this key celebration marking 20 years of the European Centre for Disease Prevention and Control. 20 years ago, ECDC was born from a simple idea, actually, that no country in Europe should face big health threats alone. And today is a day for us to celebrate together the different milestones since ECDC was established in 2005 here in Sweden. Since ECDC's founding, however, the world we're in has profoundly changed. Since ECDC's founding, the field of public health has been transformed. And since ECDC's founding, many of us here in this room have been at the very forefront of this transformation. So what has happened since 2005? When ECDC was established in the wake of the SARS epidemic, the greatest challenge Europe faced was that of coordination. Coordination between the member states and between the different public health institutions, both at the European and the international level. The importance of this coordination became even clearer in all health emergencies ECDC has been actively involved since then, such as in 2009, when the H1N1 flu pandemic was globally declared. In 2010, when ECDC experts went to Haiti to investigate the cholera outbreak following the huge earthquake. Or during the Ebola outbreak in West Africa in 2014, which was actually the first concerted effort in the field together with the member states and the Commission under ECDC coordination. Moreover, of course, in the COVID-19 pandemic, where ECDC's 24/7 emergency response remained in place more than 1,200 days to support the member states. And likewise in the recent Mpox outbreaks in 2022 and 24. These are only some of the health crises that ECDC has been actively involved in and that have contributed to strengthening EU coordination. And ECDC and all of us in the field have emerged from these emergencies always stronger, better coordinated, and better prepared than before. So following the COVID-19 pandemic, ECDC got a much broader mandate, as you know. Following COVID, we have changed the way we work, the way we collaborate. Today, ECDC works much closer with the member states and our partners than ever before, with more ECDC experts directly on the ground, hands-on, especially via the new ECDC EU Health Task Force and our preparedness missions to the member states. This was indeed a huge game changer for the relationships with the member states. The big gains of these missions to the member states are, amongst others, better getting to know each other, better understanding each other, and more trust in each other. And together, all of us here today, we have built one of the most solid foundations for independent scientific advice in public health, for infectious disease, surveillance, prevention, and response. Today, ECDC coordinates up to 20 strategic public health networks all across the European Union to help inform member states' decision-making every day. Building on this, now, however, is the time to move forward. Since ECDC was established, the context in which we all operate has profoundly changed. Today, we face a multitude of new, evolving, complex threats and trends and new challenges. Geopolitical tensions, climate crisis, antimicrobial resistance, a shifting demography with a growing aging population, and a significant increase in global travel from 370 million trips in the EU in 2005 to more than 1 billion trips in the EU today. So what do all these challenges and transformations mean for public health? What do they mean for a resilient Europe? In the end, I think we will only be successful if our work is based on 3 key pillars: trust, timeliness, and teamwork. First, trust. We know how the mis and disinformation today spread faster than any virus. Public trust, our strongest asset, has become increasingly fragile. To strengthen this trust, we need to reach the people again. We need to communicate science in a clearer language, evidence-based, trustworthy, and accessible to a wider audience. This is the only way to fight misinformation around science and strengthen trust in the work of independent public health institutions, such as ECDC. And this means communicating the knowns and the unknowns. Second, timeliness. We all need to continue to modernize our public health systems. Systems that are modern, stable, but also flexible enough to adapt to different changing types of challenges. We need to be even faster in the future. We need to be faster in our response, more timely, and more interconnected. Therefore, we need also faster and more comprehensive, large-scale, real-time data for the bigger public health picture, for a more impactful public health action in the future. Like with a blood test, a single parameter would only give us a very limited information, while the complete blood panel, including many different blood tests and parameters, provides a much broader, conclusive picture for diagnosis. Innovation, however, requires a change of mindset. Innovation requires boldness and ambition. Thirdly, and most importantly, teamwork. We need an even stronger collaboration, as I said, with the member states. A smart collaboration, a collaboration that is outcome-driven and driven by clear and common public health goals. Every outbreak, every health emergency is an opportunity to be better prepared for the next. Each crisis, each lesson, each act of cooperation strengthens our collective resilience in Europe. Ladies and gentlemen, investing in public health saves lives, strengthens economies and societies, and it strengthens trust. So the question is no longer whether we should invest in public health, but how boldly we are willing to act. We need to ask what it costs us if we don't. Health security is not a nice to have. It is a cornerstone of Europe's future. And soon we will discuss precisely this on our panel here today. Dear friends, dear colleagues, although the threats we face are great, yes, I'm confident that our capacity together to respond as a united Europe is greater. And for sure, it's much greater than 20 years ago. Our strength lies in our systems, in our shared commitment to protect everything Europe has built up in the past decades. Yes, Europe is a unique, a great continent with not only strong economies, but also strong health systems. Not perfect, no, but better than many, many others worldwide. To strengthen public health in Europe is our common mission, and ECDC will contribute. And let us not make the same mistake as many people to care about health only then when we are at risk of losing it. Let's care about health before the crisis hits, every day, together. Because a healthy Europe is a competitive Europe, a prosperous Europe, and a safer Europe. So thank you from my side to the Commission. Thank you to the Member States and to all our partners for building a public health union in the EU. And thank you to ECDC staff, past and present, to our former ECDC directors, of them too here today, who have contributed tirelessly over the last 2 decades. Here we are today, from a handful of colleagues in a small office, actually in the Solna City Hall in 2005, with Susanna Jakob, the very first ECDC director, to nearly 400 staff members today, driving public health in Europe. We have accomplished so much in 20 years. The next 20 years, however, will demand even more from all of us. More collaboration, more innovation, more efficiency, and more flexibility. Our common goal can be nothing less than be better prepared for future health emergencies and to keep over 450 million people safe from infectious diseases. But we can only do this together. The member states and our partners, the EU institutions, the people of Europe, and the ECDC. Thank you very much for your coming.
So we also have two keynote speakers for today. But first, as Commissioner Várhelyi is coming up to the stage, we will first play the video recalling some of the achievements of the ECDC.
The European Centre for Disease Prevention and Control plays an important role in providing timely epidemiological data, prompt risk assessments, and reliable recommendations for decision-making. We also support all EU and EA countries in preparedness, prevention and response in situations of public health emergencies. Therefore, we need close collaboration and dialogue with our partners, also to learn from each other and share good practices. What we communicate has to be evidence-based and trustworthy, translated into a clear language accessible to a wider audience. This is the only way to fight misinformation around science and strengthen trust in the work of independent public health institutions. Our common goal can be nothing less than being prepared for future health emergencies and keeping over 500 million people safe from infectious diseases. We can only do this together. The member states and our partners, the European institutions, the people of Europe, and the European Centre for Disease Prevention and Control.
Dear Minister, dear Director, it is an honor to be part of this celebration. We're here to celebrate 20 years of excellence, 20 years of excellence born out of the ECDC. It was back in April 2004 that the new European regulation set out the vision for an independent agency, the European Centre for Disease Prevention and Control, the ECDC. The aim was to create an agency that could serve as a source of independent scientific advice, that provided the expertise of medical, scientific, and epidemiological experts, that worked closely with networks of experts in the member states as well. By May 2005, the ECDC was already up and running in record time. And since then, you have turned the founding principles of this very agency into reality. Monitoring infectious diseases in Europe and protecting public health. You have grown from only 35 members of staff to over 400, as I have learned today. You were widely recognized for your expertise, and you continue to do so. You regularly report on more than 60 infectious diseases, antimicrobial resistance, and healthcare-related infections in the EU's 27 member states, and also the members of the European Economic Area, the EEA countries. You operate several platforms of epidemiological surveillance, epidemic intelligence, and early warning and response. You have the trust of the general public too, with around 15,000 people visiting your website every day. Together with the national authorities, you have set up many disease laboratory and expert networks in different areas of public health. You work with a growing number of international partners, including the World Health Organization and your counterparts in the USA, in Canada, in the UK, South Korea, China, and Japan, just to name the most major ones. And you are always looking to cooperate with new partners, like your developing relationship with the newly established Gulf Center for Disease Prevention and Control. The past 20 years have not been easy. You have helped the EU manage several public health crises, from the swine flu pandemic back in 2009 to the ongoing threat of antimicrobial resistance and healthcare-associated infections. You provide world-class surveillance data and play a pioneering role on antimicrobial resistance. You recognize that human health and animal health are interlinked, working together with the European Food Safety Authority in Parma, the EFSA, and the European Medicines Agency, the EMA, in Amsterdam, for example, on monitoring the consumption of antimicrobials and antimicrobial resistance. Most significantly, of course, you had to deal with the COVID-19 pandemic. The pandemic very clearly exposed structural vulnerabilities in Europe's response and to public health crises, both at national level, including all the health systems at national levels, and also the weaknesses in coordination at EU level. But the ECDC has learned from the crisis during the crisis and stepped up its efforts in the most challenging circumstances, because you responded with a rapid risk assessments and you activated your public health emergency mechanism to channel as many internal resources as possible to the response team. You provided essential support to policymakers in the Commission who have relied on your expertise as they led Europe's response to that crisis. And the importance of your role was recognized with an extended mandate starting from 2022, strengthening cooperation and your capacity to now prepare and respond yourself to crises. From 2020 to 2023, all of you faced an exceptionally high workload. You responded to the COVID-19 crisis, but you also managed to maintain your routine work of monitoring other infectious diseases. As we reflect on 20 years of work today, it is my honor to thank you, in particular for the efforts during this unprecedented public health crisis, which Europe has championed thanks to your help. The lessons from the COVID-19 pandemic have shaped all our work on EU public health since then. And they will shape the future for the ECDC as well. As we build a European Health Union that should protect the health of its citizens, both in times of crisis and in normal times. The Commission is currently preparing the EU's prevention, preparedness, and response plan for health crises. We will present this still before the end of this year. The plan will strengthen the EU's capacity to prepare for and respond to health crises. It will help to build EU and national resilience, including through regular stress testing. Of course, I count on the support of the ECDC in implementing this plan. The ECDC is already in the middle of its first cycle of public health emergency preparedness assessments. Shifting from this first cycle of reporting into continuous routine cycle of assessments, as well as improving plans and testing those improvements. This is another important step to ensure that Europe is better prepared for any health crises that may come, and they will come. The ECDC's mandate includes now also monitoring vaccination coverage for major infectious diseases in each member state. These two priorities go hand in hand. We need to know to what extent vaccines are reaching the EU population. So I want to ask you to fully set up this monitoring scheme as fast as you can with using the latest technology, including artificial intelligence and big healthcare data. Another important priority for me as Commissioner in continuing the work to fight antimicrobial resistance and preventing healthcare-associated infections. We need to work very closely with the Member States to reach the 2030 targets set out in the Council recommendation from 2023. And I'm confident that the ECDC will continue to support the EU and the EEA countries with the expertise and guidance to progress towards these targets. The importance of digital surveillance data on health and disease is another strong lesson from the COVID-19 pandemic. This will be supported by the work to complete the European health data space and scale up genome sequencing capacities. We are supporting EU and EEA countries with 83 million euros from the EU for Health program to improve their national surveillance systems. Your role is vital to coordinate the future European health data space for epidemiological surveillance. I'm sure I can continue to count on your support on this long journey, and I was very encouraged by the message in that direction from the director herself. Since 2021, we have made a lot of progress in implementing European reference laboratories and on whole genome sequencing. The first EU reference laboratories are up and running, and more are being planned. So I'm counting on the ECDC to continue to coordinate these networks and to plan strategically where others are needed. So, dear colleagues, if I may, over the past 20 years, you have provided your expertise at the service of Europe. You helped us overcome a pandemic, and you continue to monitor health threats and infectious diseases. As policymakers, we will continue to rely on you, and we will continue to support you in this work. Thank you again, and congratulations to all of you. Thank you.
Thank you, Commissioner, and thank you for those words for the ECDC. You are joined also athletically by the Swedish Minister of Health for your keynote presentation today. Please.
It's so good to see you all. Sometimes the little world and the big world meet. The great piano player that helped us set the stage today for this celebration is also the same piano player that plays to my kids' school choir every Christmas. So I get to hear him a lot more than you do, maybe. So that's good for me. And also great to welcome you to this great venue. It's warm and cozy in here. Just right outside here, I ride my bike to work every day. And Sweden is, you may or may not know this, it's a dark and quite chilly country sometimes. So you have to fill yourself with the feeling that I have to do my part for the European public health by riding my bike every day to work. So that's why I tell myself when it's tough. Thank you so much, Pamela, for this speech. Thank you so much, Olivér. Great to hear your thoughts on this issue. And it's so great to stand here in front of you at the 20-year anniversary of ECDC. Since its establishment in 2005, ECDC has been a very important agency in which Sweden has great confidence. Over the past 20 years, ECDC has continuously adapted to meet new public health challenges, as we have heard, and has become a real cornerstone of Europe's defense against infectious diseases, protecting the health of over 500 million people across the EU. And Sweden is so honored to be the host of the agency and the host country of ECDC, and we are proud to do our part in contributing to strengthening public health sector across Europe. The presence of ECDC in Sweden, I believe, also reflects Sweden's long-standing commitment to international cooperation and evidence-based health policy. We see that the ECDC has an important role to support member states and to act as a driving force in the progress to strengthen the European Union's preparedness for cross-border global health threats. It is only through united and coordinated efforts that we can effectively confront these challenges, as was clearly demonstrated during the COVID-19 pandemic. During the pandemic, the role of the ECDC was strengthened, and Sweden welcomes that the agency really steps forward when needed by coordinating responses, assessing risks, gathering data, providing guidance. The preparedness against serious cross-border health threats is part of society's crisis resilience and a cross-sectoral commitment. Sweden has a fundamentally strong and well-functioning national system to handle health threats, and to us, it is crucial to constantly maintain and develop our ability. To that, we need the international cooperation. So we really appreciate the ECDC's focus on fostering collaboration across sectors, mandates, and borders. When facing global health threats, it is important to work with agencies in different sectors with a One Health perspective, as we have heard that the ECDC is doing. And I think another highly appreciated part in the ECDC toolbox is the assessment work. I really think this is so important to help us step up even more in the countries. For instance, in 2024, ECDC conducted a public health emergency preparedness assessment mission of Sweden. And this assessment resulted in several recommendations for Sweden to improve our preparedness and work is now underway to address the proposed recommendations to make our system stronger. ECDC has also conducted a country visit focusing on the National Action Plan on Antimicrobial Resistance, on the AMR, in a One Health perspective. And a report has been published from the visit, which we are currently using when we are revising our national AMR strategy. So ECDC is really helpful in doing this, and I think all member states could really benefit from this assessment. During the Swedish presidency in 2023, I'm proud that the Council agreed on the recommendations on stepping up European Union actions to combat AMR by 2030. And I think we all need to step up our efforts at both national and European Union level to continue the implementation of the recommendation. 2030 is just around the corner, and unfortunately, resistance keeps growing. As I mentioned earlier, ECDC has been a tremendously important agency these past 20 years and will continue to be so in the future. And I believe the ECDC is somewhat a symbol or a representative of the European Union when it's at its best. Coming together, collaborative, using the strongest possible expertise, joining forces to protect the health and the lives of millions of Europeans, but also to be a leader in the international health system. When others are failing, we are building strong institutions that are reliable, and I think the directors put it very well, that builds trust, that are so prepared that they can act timely, and that we are really joining our forces, team up in Europe. When others are failing or trying to dismantle the international health systems, we are doing quite the opposite, and we are celebrating 20 years of doing so today, and I think this is just great. And I just want to ensure you that Sweden is committed as the host country to ensure that the conditions for the ECDC to continue be this pillar in the European health system to continue. And we look forward to continuing the cooperation and to strengthen together the European Union's preparedness and the resilience to global health threats. Thank you so much.
Thank you very much, Minister. And if I may invite Commissioner, you as well, to come up and join us, as well as the other panelists who I will introduce as you all come up to the stage. So as well as Minister Forssmed and Commissioner Várhelyi, We are joined by Brigadier General Peter Iversen, who is chair of the Committee of the Chiefs of Military Medical Services in NATO, Professor Marion Koopmans, who is Scientific Director of the Pandemic and Disaster Center at the Erasmus Medical Center in Rotterdam, and Henrik Ullum, who is Professor and Chief Executive Officer of Statens Serum Institute, Denmark. Would you join me in welcoming them to the stage, ladies and gentlemen? Commissioner, I'm afraid I'm going to have to start with you first, if I may, because I know that you are slightly diary constrained in terms of having to leave fairly soon. I think we're very grateful for the recognition you gave to the centre in your introduction, and we heard the achievements which the director also set out. Looking more broadly for the European Union as a whole, as Commissioner for Health, what do you see are the crucial contributions that the European Union should make to build health security more generally, and how should we do it?
Well, it's I don't think we have time enough for all these aspects that we should cover. But if you ask me, I think I need to give you a couple of points. First of all, we need to overcome the challenges that we're facing for quite a while now. And the COVID pandemic was a major wake-up call in this regard. And we still struggle to address the heritage since the COVID. And here I'm talking about shortages, I'm talking about stretched value chains, I'm talking about access issues. I think we all remember this. And this is why it was so crucial to come very quick early in the mandate with the Critical Medicines Act, because the Critical Medicines Act is supposed to address these problems. Shortages of critical medicines as they appear on the ever famous list of the EMA, but also the access problem that we have seen in many member states, which are creating also public health risks in a number of countries. And with this, we try to create a market. So to create a market out of a problem. And to create an economic case for these member states to be supplied by the companies with the necessary stocks that they need to address any crisis looming. The other part of this is the very stretched value chains that we have seen as non-functional during the pandemic. And it is for that reason that now we need to do everything to get production back to Europe. Or if not the EU as such, but as part of our value chains. On our continent or very close to us. And this is why, again, the other major element of the Critical Medicines Act has been to create financial but also administrative incentives to bring back production. But it will be only as good as we see companies actually moving. So this is going to be the test for me for next year. And I hope that the Council will be able to agree quick, still this year, on it. And then we can move on, agree with the Parliament quick, so that we can already start to see companies moving back, companies providing us with the supplies we need. Of course, the other element is to use innovation more strategically. The director already explained how she wants to use the latest technology in prevention and also in foresight. And I think that the use of artificial intelligence, the use of big healthcare data is the way to go. This is going to be our tool for the next century. Not only to prevent or address crises that are around the corner, but also to foresee them. because the big data will show us all the risks that we don't see currently. So that's going to be another major evolution. Something, again, we are trying to deliver still this year with the Biotech Act. We want to let loose the possibility of innovating with these, be it for treatment, be it for prevention, be it for diagnosis, be it for rehabilitation. We will have to really use the potential Europe has with the creation of the European health data space. And then, of course, we need to also address the other main cause of death in Europe, the chronic conditions, the most known, and maybe, if I may, the easiest to address, cardiovascular diseases. Cardiovascular diseases are the single biggest cause of premature death still in the EU. Over 37% of all the deaths are related. If I count also stroke, then it's even higher. And we know what needs to be done, but we haven't done it. So this is why still this year we will come with the cardiovascular plan, which should be the first vehicle, the first interface, if you will, for the new technology to be put into service of the people much faster than we have seen before. And then there is the preparedness, prevention, and response plan that we are still designing also for this year, in which we want to give you basically the whole feature of the tools that we have in hand, which we could use more strategically to prevent any crises looming, but also be aware of all the necessary tools that we need also to develop in practice, because many of them are just policy tools. They are not actual tools in the hand of those who will have to fight the next crisis. So this is just a small flavor of what needs doing, and I think I also see Sandra here, and I think that we keep Sandra and the team very busy with all this. But from next year, I think you will see a completely new approach emerging, also when it comes to the situation on the ground.
Thank you, Commissioner. For a short intervention, that was a long list. And if I listen to that intervention, it's very much seeing health security as part of what we've talked about in other contexts as health in all policies, seeing it really integrated across the full range of EU tools. And I've heard you talk about the health ecosystem in other concepts and seeing that whole connection of innovation. One of the points I think that the director made was about the cost of inaction. What are we risking if we don't act, and how do we keep attention on this when, for example, we're talking about the new financial perspectives or about other challenges? We know there are many other challenges facing Europe more broadly. How do we keep this sort of political focus on health given everything else that is going on, do you think?
You don't think we have the focus? I'm going to just give you a whole list of things I'm doing this year. I mean, but this is not a focus. I don't know what is. To keep the focus is not particularly difficult if you know what needs to be done. Because first of all, the public is very much focused still on health. Ever since the pandemic, this has changed in a major way. If you look at the Eurobarometer surveys, which are the main topics of concern, and we are not talking about crises, but which are the permanent topics of concern for the public, what you see is that health is either in the top 3, depending on the period, or in the top 5. So the public do care about this issue. And ever since the pandemic, if there is one conclusion I get from anybody I talk to, from policymakers to dignitaries, to my family, to people on the street, is that we don't want to have any of that anymore. And we don't want to be caught off guard again, like we have been in the COVID crisis. So that is already a different level of alertness in the society. And this also means that we now have to address, as I told you, the homework that we knew existed, but for other reasons, it has always been postponed. But now we need to really do the homework, not only because of the next pandemic might hit us, but also because the geopolitics in the health sector are also becoming an issue. Meaning that the very system which we are so proud about, the very European construction of health systems, meaning that we always have the most state-of-the-art treatment and medication, and we always have it for everybody available in Europe, might be in very serious danger. If you look at only what we see in terms of discussions around the pharmaceutical sector in the United States and the possible impact on our system of that debate, we have no time to lose. This is why I am pushing so hard for all these proposals, because we have to give a perspective, a clear perspective for the next 5, 10, 15 years. How are we going to ensure that we continue to enjoy the state-of-the-art treatment, and all of us will be able to enjoy that. But for this, we need now to focus on industry, that they keep on innovating here, that they keep on testing here, and they keep on producing here. These are the guarantees that we will be able to continue to run the very sophisticated and maybe the highest quality healthcare system there is on the globe. But we have no time to lose. We have basically months to start to address this problem. So yes, next MFF, if you look at the proposal, it also reflects that. We have set aside 22.6 billion euro for health and biotech. This is a major increase, if I may put it like this. Health is one of the biggest winners of the whole MFF proposal. It's not been talked about because only bad news is news. But if you look at the other part of it, you have 20 billion euros set aside only in the horizon part, only for research and development in relation to health. So we are talking about a budget never seen before, roughly 43 billion euros. And if we use it strategically, together with the regulatory policies that we are rolling out, and together with the public health programs we are rolling out, like the cardiovascular plan, this should consolidate or even reinforce the healthcare system that we have.
Thank you very much. That priority of citizens, of course, Minister, is something I'm sure that you're very familiar with at national level. Sweden has long supported this European collaboration, as you mentioned, and thank you again. And it's all the more impressive sat here in the Karolinskas Hall. What do you see as the key priorities at national level for you as a national health minister?
I think it's quite similar to the ones. The health is the same for the people, and I really appreciate what the Commission is doing when it comes to competitiveness and getting more investment in Europe when it comes to critical medicines as well as innovation. And I think health security, as we are discussing here today, is also raising everyone's health a little bit. That also gives us more health security. I mean, we have a situation now where kids' mental health is having been a big issue for several years now. We have a decline in when it comes to stamina and coordination and things like this, giving more room for the non-communicable diseases to get into everyone's body, actually, for cardiovascular or whatever. So I think this is very important to keep on working with this. But also, if I should look at one threat that is under discussed, is the AMR, antimicrobial resistance. This is really threatening the healthcare system. It's threatening the modern healthcare system, and we are not discussing it or doing fairly enough. We're trying to do more in Sweden to get our agencies together to work in a One Health perspective, new strategy. And I also think the recommendations need to be imposed in all the member states. I think there is also a need for stewardship when it comes to this. I mean, we have a situation now. We're talking about state-of-the-art treatments, but right now we're losing basic treatments. We're losing the effect of narrow-spectred antibiotics all across Europe. Many countries you cannot use them because the level of antimicrobials are so high. So this is also very important to keep the treatments that is working, to keep them working, and also to keep them on the market. I mean, there is a market failure here. We don't want to use these treatments only when we have to. So we really need the new incentives to keep old antibiotics on the market. We're working with that in Sweden, together with the Nordic countries, to create different models, the Netflix model to be part of this. And we have also been pushing very hard on getting incentives on the European level when it comes to creating incentives for new antibiotics. We can discuss the state-of-the-art ones, and we should. That's really important for Europe, but we don't keep the ones that it has really created the modern healthcare system. Well, that is really a bad situation. And I always feel that we are human beings and we like to put the latest crisis behind us and just focus on the new ones. So we have a big discussion about the antagonist threats towards ourselves, and we should have that. But we should also realize that the big threats are still the ones that are diseases or non-antagonist threats to our part of the world as well.
Absolutely. Thank you. Do you need to, leave? He says, do you want to make any final comments before you leave, or are you going to? Just wanted to give you this chance. Because from AMR, it makes a nice bridge, Professor Koopmans, to you. I know that these kinds of issues have been a concern of yours down the years. Thank you, Commissioner. And please, let's thank the Commission. So, if I can turn to you, because I know that you have a perspective on different, how these threats have changed over this 20-year history of the ECDC and maybe what we can see coming. So, what's your perspective on this?
Yeah, so before I go into that, let me just wish everyone here a happy birthday, because we did see this baby being born, crawl, stumble every now and then among very critical friends across Europe, starting to walk, starting to run, and really establishing a very strong foothold in a space that is, I don't think there's anyone that disputes the existence of an institute like this. So congratulations, that's a big accomplishment. So towards looking at what is ahead, I think, well, looking over the past 20 years, I think what we really have seen is the establishment of what is termed the Anthropocene. So a time, an era where we see more and more health problems that are a consequence of our human impact on the planet in many different ways, whether that's lifestyle-related diseases, whether that's climate-related health issues, whether that's spillovers and spread of new diseases coming from our incursions into pristine environments. So I think that's there to stay. And it's been, I'm quoting Mike Ryan, the former head of the emergency office of the World Health Organization, who said that after the West Africa Ebola crisis, which really was a new pattern of spread that we saw, that was very different from what we've seen before. He said, you better get used to it. This will be the new normal. And that means we heard it, everyone wants to have things behind. That's not going to happen. We're going to have to think, okay, how is this constant threat? How are we going to build that into our way of working? Not ignoring the core programs, but also not moving from panic to neglect, which is a bit the situation that we see. So I think that's one first point. Second, real important point, I think, is using the term complexity. If anything, we've seen with the pandemic, for instance, is just how complex and how interconnected the problems are that we see heading our way, and certainly also the problems related to this, the Anthropocene. Think about the relationship between climate change, countries working on defense, upping their defense for sea level rise or for flooding, building wetlands that may be perfect habitats for mosquitoes and cause mosquito-borne disease outbreaks. We have to start bringing these worlds of thinking together to move jointly together, but it's complex. These are complex systems, complex problems that require joined up thinking. And without, I think if you look in the literature of the wicked problem terminology, what you see there is there's not single solutions. It always is multifactorial and continuous tweaking. So that also means not only bringing what we currently have, epidemiologists, data scientists, laboratory experts, One Health experts together, but broadening up technologists, climate science, social science, very important. So I think that's what is ahead. So broadening up the sort of the network of experts that we need to bring in. Third bullet point I have is societal resilience, because that's of course something that also was a big kickback from the pandemic. Initially well accepted biomedical approaches, biomedical advice, but increasingly, at least in some countries, certainly in my country, increasing pushback from not only many different types of scientists, but also the general public saying, hey, hang on, we have something to say here. Who are you deciding about our fate? We want to know more about this. Is this really what is done? Sweden is doing something very different. Why are you not doing the same? So the societal and behavioral aspects of building resilience, and I think the good news is society wants to be part of this, wants to be able to, understand what is going on, who decides, and what are trusted parties. So I think as challenging as that is, we need to work on that. Also understanding vulnerabilities. We have vulnerabilities in terms of health and people with more chronic health problems. We also have vulnerabilities in where you live, where you work, where you were born. Many different types of vulnerabilities that, of course, we are starting to see also politicize and demanding more and more attention. And it's really something to bring in. So it's a transformative time. The baby has grown up, so it can get more challenging problems. Transformative time, and I think it's important to also reflect on what will come. Yes, preparing for response is important, but we also cannot know everything that will come our way. So flexibility in mindset and flexibility and who to work with is going to be critical. But I also want to emphasize that I think the time is also exciting. There's fabulous new tools. We've seen just the rollout of wastewater genomics in a pandemic. Wow, who would have thought? We see the data science explosion. You will address that with its opportunities. We see people, so land use engineers working on climate resilience saying, oh, hey, hang on. Yeah, I had some questions about mosquitoes. Let's do this together then. We can tweak these things. So I think there's also opportunity for thinking and for rethinking how we work with the disease threats that are coming our way, but with a permanent and broader ecosystem of learning of experts, and that involves also citizen scientists, and whoever wants to have a seat at the table.
Thank you. There's a sort of a theme here of broadening out from health security and health threats to encompass lots of other dimensions of society. So the Commissioner was emphasizing the industrial and economic dimension and supply chains, and Minister, you were talking about antimicrobial resistance and some of the wider threats that reach across different dimensions of society, and you've taken this even broader, Professor, into the Anthropocene and the sort of the complex systems that you've described. General, if I can come to you, because I think you might bring in another dimension again. So we think about, in defense terms, resilience can be seen as being about the defense, the military forces themselves, but also going beyond that into the resilience of the whole of society. And how do you see health in relation to that? How can we be thinking about resilience and maybe links into the kinds of issues that you work on?
Thank you. It's a very interesting thing. I think that, to start with, a healthy nation and a healthy population is a resilient nation and a resilient population. And we've seen now ongoing war, open war in Europe for more than 10 years, a full-scale war for 3.5 years. We see an aggressive Russia and Europe preparing for a major conflict against Russia to protect itself. And we know that the nature of military operations is to influence your enemy's will and behavior, so you can enforce your will on them. And I think that health is a very important aspect of that, because if you weaken the health of a nation, or you weaken the health of the population, you will be a much more easier target. And we are facing now new threats that are maybe out of the known threats that we know today. We know that we have an opponent in Russia that does not respect humanitarian laws. We know that they have attacked a lot of health services in Ukraine and so on. And so we know that they are willing to influence our health to get their will. And I think that we need to see that a large-scale war will be a public health disaster. So there is a close connection for us in the military between to keep up the nation's health, because a war towards an opponent like Russia won't be a war between armed forces, it will be a war between nations. So due to have the preparedness, and we see it in Ukraine, it's a public health disaster. Chronic diseases are worsened because of the lack of treatment, the lack of pharmaceuticals. There are people that have injuries caused to war actions. We know that the antimicrobial resistance are increasing. It's much more difficult to treat normal infectious diseases. So it's a wide spectrum. And I also want to bring it into the new dimension of using biotechnology, combined CRISPR and artificial intelligence as a potential threat to use it as a weapon. And I think we're facing a future where our imagination cannot be wide enough. We need to think in a wider scale what can threaten our health, what can threaten our nations, and we need to connect it to security, because we know that our opponents are willing to use this. So I think the armed forces cannot handle this alone. We need a whole of society approach, and we need centers like the ECDC and other important centers across Europe and across the world to help us keeping up the health of our population, to be resilient to new threats, to have a good surveillance over what's happening out there, both to known and unknown agents. So for me, resilience, healthcare, a healthy population, and not only the population by each single inhabitant, but also the health of the nation is a part of this. And I think we need to bring it into this discussion to be prepared of what can happen in the future, what can happen in 10, 15, 20 years. Will it be a war of kinetic warfare that we see today in Ukraine? Or will it be a more hybrid warfare with use to influence the enemy's health to get their will? So I think we are facing a future with a lot of unknowns. And I think that we need to bring our nation's common values and resources together to see what can be the threat in the future, and we need the whole of society to approach that.
Thank you. So on the positive side, I take therefore that the success of our health systems and the strong health systems that we have is also an investment in that whole of society resilience, but you raise a whole set of connections about why that matters also for defense and resilience in the face of intentional threats, which we can maybe come back to. But Professor Ullum, we need some grounds for optimism, and there is. The Commissioner referred to it, Professor Koopmans, you referred to it about the potential of technology and the use of AI. We have things like the European Health Data Space. We will have data from other data spaces at European level. Where's the potential, if you like? How do you see these different technologies affecting our resilience, and how can we make best use of them, do you think?
Yes, thank you very much for that question. But first of all, please allow me to congratulate ECDC. I think really ECDC has proven itself as a very, very strong pillar for European health security. So warm congratulations on that one. Yes, we need some optimism, and I think although we heard about all these complex health problems that are staggering up in front of us, I think it's also nice to know that we have some good tools and some tools that are also growing in strength. And Marion already mentioned it in science and in technology, our options are also growing. And I'm really glad, now the Commissioner is not here, but he mentioned both digital surveillance, he mentioned AI, and I think these are two of the tools that we should really encompass and really use in order to fight these complex, wicked problems that we are facing. But we need to do it in that order. We need to focus first on the data, because if we don't have good data, we cannot make good AI. AI is, so to say, just the icing on the cake. So let's focus on the cake first. I think looking into the future, I think we can still learn some from our past crisis. If we take a look at COVID-19, I'm lucky to come from a country where we have ability to link all health data together. We can do that real time. We were also able to build a very large testing system, so we exactly knew how many infections there were throughout the epidemic, and also being able to make a very large-scale sequencing system. And why is that important? It's important because what you, with such assets, can do, you can make a data-driven crisis handling, and I think that's very, very important. And just to be very practical, that meant whenever we had a new variant of concern, we could quickly evaluate how is that looking out of transmissibility, how is it looking like in severity, and meaning that we could kind of close down the society and avoid excess mortality out of these severe new variants, including the Alpha variant, Delta variant. Secondly, it allowed us to access the new vaccines, to choose the ones that had least side effects, most effects. And thirdly, when we were facing the Omicron, we could see, okay, we will have massive amounts of data, a massive amount of infections, but actually the healthcare system would not be so heavily hidden. And therefore, we could open the society as the first country, February 1st, 2022. So this is what I think we should aim for, to be able to handle crisis, detect crisis early with good data. And to do that, we need to have large-scale data, so we have an image of what's happening. The data should be of high quality, so that image is true. But most importantly and most difficultly is to have fast data, real-time data, because if you just have old data, you cannot really react in a crisis. And then we have heard several trouble facing us. We talked about climate change. I think that's one area where we could use both data and AI. One thing is to see what will happen in the long term, but even then we have short-term changes in mortality and morbidity. We see big waves of disease in winter. We also see excess mortality when we have heat waves, and that put our healthcare system under double pressure, because you have pressure of more patients, but you also have pressure of more sick leaves among your staff. And just to predict that, what will actually happen in the next few weeks, there we are in an area where we have too many data that the human brain can integrate, and that's where I think that's one area where we need AI. Similarly, talking about AMR, if you have all available data, as we have in Denmark, we have complete medical history, all infections, all antibiotics prescribed in a life, we think that we can predict what will be the most effective antibiotic when a new infection occurs. But of course, that's nice, you can do that in one country, but we need to be more ambitious, and we need to do it on the societal levels. Okay, if we use One Health approach, take human data, animal data, environmental data, plant data, then we could do it on societies and see, okay, what will the AMR pattern be in the future? And as really glad the minister also had focus on that. And that from that we can say, okay, what tools will we need in the future? And then one area where I wish that we had the tools, but I really, really hope that ECDC will find some strong tools. There's this whole problem of misinformation, which I think we faced heavily during COVID-19. We are facing it again in a situation with geopolitical instability. And we can see it's a threat to the public trust, which is so important for our work. And again there, we need data to collect what's happening in information campaigns, and we need analysis tools to see, okay, are there patterns, so we don't need to see everything ourselves. And also we probably will need AI to find good responses to that. So importantly, I think it's that we need to do these things in member states, but we also really need to do that on the European level. And of course, there the European health data space is a wonderful asset that we really hope to see play out. And then finally, coming back to the director's initial talk, really loved the saying, okay, no country should be alone. But I think it's also important that ECDC knows and realize that you have so many friends. There are so many public health institutes, and I know a lot of colleagues in the room here that would really do their very, very best to make ECDC a continued success in the next 70 years. Thank you.
Thank you. And it does feel slightly like a family reunion. And that's been a bit of a theme throughout today. But we want this child to continue growing healthily. And I have to say, if I come back to your example about it, even in Denmark, if I may say, having worked on what was being called at different points e-health and digital health, even in Denmark, that issue of trust and being able, like, it wasn't an overnight obvious achievement to be able to put in place the kind of data that you have that provides these kinds of foundations. How do we build, what lessons would you draw out of that about how do we build the understanding of the importance of resilience and of how this data can be used, and the trust in the institutions that allows us to have that cake of data to work from?
I think first of all, we need to, and this has also been a theme, that we need to realize it's a long-term investment. And that with good data, we can provide good information, and good information is a strong source of trust. And then secondly, if I look at some of the most successful data infrastructures we have, they have like a triple purpose. So I come from public health, but the most important is that the good examples of data sources are the sources that the patients / the citizens can access themselves, so they can see their own data. the clinicians can see their data and they can use it for clinical use. And then finally, we can use it for surveillance or research across academia and public health. And I think if you hit that triple purpose, then you also have an argument why you need to invest in these data infrastructures. Because if you say, oh, we need to invest a lot just in surveillance, you may think, oh, where's the business case? Is this really good enough if nothing happens? But if you build it in a way that it benefits the clinical work every day, then you have the business case.
Thank you. And this was one of the challenges I wanted to come back to, and it's a little bit the same question I put to the Commissioner, which is, we know there are so many pressures on public finances at the moment. There are so many pressures on public services. And one of the discussions that we've had during the day has been about resources and priorities. How to make this case for continuing to make the kind of investment that we're discussing and has already been made in the ECDC for the last 20 years. Marion, did you want to come in on this already?
Yeah, I comment and the question actually. So what we've seen is data intelligence, and I think everyone in Europe looked at Denmark and the UK and Qatar, remarkably. Can you foresee that maybe we have a couple of places in Europe where this type of intelligence would be built, so not every country has to do the same massive investments, and that some of this burden is distributed? I've also been thinking about that in every country is upping its influenza surveillance, yet does that could we maybe have more regional hubs to do that? Because that on the long run makes things maybe cheaper or more affordable. Of course, we will come up with new things to do, but do you think that's possible?
Yes and no. It's possible, and somehow that's the way we need to start. And now being in Sweden is another place where such things is really possible. However, the thing is about data. The data patterns that you see very often, they goes for this society. So if you have strong hubs in Northwestern Europe where you can really use strong data and see what's happening real time, yes, that's good. But maybe only good for Northwestern Europe. If something is happening somewhere else in Europe or elsewhere in the world, you need to have some data from these areas. So yes, I would be a believer in having hubs where you can really say, okay, here we need to collect strong data. But these hubs needs to be more distributed in the future. And then what you also mentioned on, that's sewer water monitoring. I think that's an important asset also in areas where you do not have the epidemic intelligence in place right now.
One of the important concepts that was discussed earlier was around equity and around, not every country is the same. Obviously, every country in Europe is different and they might take different routes and have different capabilities, but also having an understanding of the different challenges and the degree of equity across Europe as a whole. And Marion, I guess that's part of how we ensure that societal commitment to addressing this, is that everybody sees a level of sort of solidarity and equity in that process. I don't know if you wanted to.
Yeah, so that's part of, for instance, there's a consortium across Europe, Durable, that was HERA funded, that tries to look at this. So what is a sort of critical, that's more on the research side, what is critical research capacity that you would want to see so that can be pivot to action immediately to look at what is the transmissibility or the severity of a new pathogen. Where we're also trying to see, okay, what is the expertise across Europe? Because often you don't even know all of that. So it is finding ways to bring together people that may not naturally meet, because the ECDC has the public health institutes in its remit. This is more academic environment. Where you don't necessarily meet that easily, except for in projects or in meetings, and also trying to work together to see who could do what, because there's a lot of knowledge and brains and expertise, but it is finding an ecosystem to really work together, and working together is a sure sign of also being able to pivot together when a problem arises, when a crisis arises.
General, this sounds also a lot like how NATO works in some ways, with different capabilities but understanding what the different contributions are. But I don't know if you wanted to come in on the more general point as well.
I think that to have the same situational awareness across Europe and across NATO, across EU, is really important in these issues, because we, as an alliance from NATO, we have different responsibilities, but we also work cross-nation and support each other. And I think in a complex matter as, for example, synthetic biological agents, potential new threats to health, I'm not sure that each nation will have the situational awareness needed or the capacity to work with this issue if you look into the future. So I think that collaboration across Europe is really needed, and we need to work both across the different governmental instruments that we have in Europe. And I think if you put the trust aspect into it as well, you've all seen the situation with drones across Europe and the uncertainty that this kind of episodes make the people feel afraid. They don't know what's happening. So I think you can have the same with, if there is a threat to health and we don't know where it comes from. Is this a voluntarily thing happening, or it's a nation that are providing these events, or it's just naturally occurring? So I think we need to use that data. We need to have transparency in this data. We need to have an open communication about that, so we can know if these threats are volunteered or if they are naturally occurrent. So I think the work of ECDC and similar agencies across Europe is really important if we want to keep the public trust and try to not give in to what our enemies want to, that we become uncertain and are diverting into all the different directions, that we can have a power for public health in Europe that's unified. It makes it resilient, and I think that even if we are a healthy Europe is even a deterrent towards an opponent. So I think to combine the different civilian aspects and the security and military aspects of this are really important in the future.
Thank you. And I think, and this is something we work on at RAND as well, is around the expertise of assessing, for example, the potential dual use of some of the new and emerging technologies. I mean, the Commissioner is talking about the Biotech Act and some of the biotechnology things that not only will not every country have that expertise, it will be challenging for Europe as a whole to have that expertise. So I'm sure that's an area. I see lots of nodding, but I will, Minister, I know that you wanted to come in on this broader point as well. So perhaps to you.
Just when you said we need more hope in this discussion, and I think this discussion about the data is very hopeful. I mean, to unlock the data that we have that could really help the individual with their health, as well as research and surveillance as well. And for Sweden, we have some tremendous data just waiting there to be used for the benefit of the many and for the benefit of the individual patients. I mean, precision medicine, it relies on data. And we now have a very interesting field of precision psychology, where you can, before starting the treatment, knowing if it's going to be effective or not. Instead of trying different treatments and hoping for them to be effective. I mean, this is very, very, very hopeful. And the thing we do now together in Europe when it comes to health data is going to unlock a lot of potential to at a lower cost, bring in more innovative treatments to the patients. So I think this is very hopeful. And also when we're discussing the misinformation, I just want to say that this is also some area where the European Union can play a real big role. I mean, we have both ECDC, we have the European Medical Agency here today, bringing transparent data to the public about vaccines, for example. That is so important these days. In Sweden, we still have a tremendous vaccine coverage when it comes to kids, but we also see some areas where there is not as high, and that is also when it comes to discussion about equity. Those areas are also having lower life expectancy and so on. So you need the transparency, you need the European agencies to be there to have the clear data as transparent as possible, but you also need the individual meeting to build that trust. So that is also very important, not just to rely on the data is out there, but also to have the individual meet at an early age when the kids are small, getting to know the treatment staff that will follow them during the first years to build that trust. And I think that is also important to remember.
And from your perspective, again, coming back to that national minister perspective, what do you want from Europe in this? Because Sweden is it's a very strong country in this kind of regard. How can Europe support you as we look to the future in terms of these challenges?
I think the assessment part is really important. So to keep us on our toes is really important. What the ECDC is doing with the country visits on AMR and on the health risks is very, very important. And also to have these recommendations. It really helps with the vaccines. We have taken the recommendations on the HPV vaccine, for example, from the European Council plan. Now we're rolling this out to the Swedish population, trying to get rid of that disease. So that is really helpful. But I think as much transparency as possible will really help when it comes to trust. We have some issues there with the European Union, where the European Union is not as transparent as it could be when it comes to the vaccines issue, for example. We have highlighted this several times, and I think more can be done, because this is trust is the best value that we have when it comes to public health.
And Marion, I sort of want to come back to you on this slightly, because you raised this question of the sort of the societal level of and the complex challenge. It's because it's very striking to me. We're having a discussion about resilience. We're talking about the past and the future of the ECDC, and we're almost not talking about communicable diseases. Apart from AMR, we're talking about much bigger societal challenges about economics, about values, about trust. But this is going to be the world that the ECDC has to navigate, right? So
I think it's going to be the world we all will have to navigate. And I do see that as positive. So I do think there is, it's hugely challenging, but it's also, there is convergence of thinking that this is really a step that somehow needs to be taken, whether it's from the security side or from the health, infectious disease side, or from so I do that. So that is what I see as opportunity. Just how is a bit of the next step and a challenge, but I do think that is important, because the what I think is a risk is that we keep focusing on what we think is controllable and preparable. And that we do not address there is a reason why we keep seeing new spillovers. There's a reason why we see climate change. That's also us. And that's a tough societal debate. I'm in a country where that debate has led to very big political turmoil, but it is a debate that I think Europe needs to face. And maybe Europe actually could also maybe set an example a little bit, as it's extremely difficult, but there are limits to what is possible, and I think that's part of a discussion with society that needs to be had. We've seen that in the the resource allocation for hospital care during COVID. There were code black discussions in several countries. There are limits to what we can do. And how do we engage in that debate as a society? I think that's really something that's coming our way. Everyone working in the health space is coming our way. So, yeah, I think also ECDC, so that is looking at, that's why I'm asking, does every country have to do more, or maybe selective? Or, should we all not be thinking about thinking in terms of, okay, if you did this, I don't have to do it, kind of. it is difficult. I know it's difficult, but thinking in those kinds of terms as well.
Henry.
Well, a lot of the things we're discussing now is examples of wicked problems. And we all know that if you're dealing with wicked problems, you need a multidisciplinary approach. And therefore, it's also really, really nice sitting here as a representative of public health, next to academia, next to military, next to politics, because we need to draw on all assets. And it's also really nice to learn that EU has taken this One Health approach. And this is something we have worked together with academia and public health for many years, know that we need to collaborate. But this idea that microbes may also be more important in the military arena, I think that's a new development. Of course, we always known this could happen, but it's a new, I think it's a new scene, and I think we also need to focus on that. And then again, also what the minister mentioned, looking at production, looking at the economy, making sure that we have all the assets for a resilient society. I think it's important that we reach out into each other and learn from each other.
Jen?
I think we have close cooperation on many areas, including security and preparing for war. And I think it should be transferable and easy also to share and to collaborate on this issue concerning health. I think we should look more into an alliance also on other issues than security. So we need to do this together. It's a collective responsibility, both to keep Europe's health at the highest levels possible, to solve issues together, and to try to be a wider front of resilience. Because look into the military perspective again, we know that our opponents, he or she, want to hammer wedges into our coherence and split our coherence. So I think that more joined understanding of what could be the possible future threats, and I see from the positive side the what we can do together. I think it will be even more important in the future, and we need to tighten these connections. But to do so, we need to have a transparency. I think transparency is the buzzword here. If we want to trust each other, we need transparency, and we need to know that we have we need to solve the same problems to be stronger together. So I think I'm looking for positive for the future if we can develop this even further.
Okay, so let's I'm determined to end on some positive notes, because we have such a positive story from the ECDC from 20 years. We have such a strength of coordination. We have a strength, that strength of coordination and community across Europe existing within what the commissioners refer to, or several people have referred to, as the strongest collective commitment to health in the form of European health systems anywhere in the world, I think we can say. So we start, Pamela, I'm borrowing from some of your lines that you've used elsewhere. Okay, we start from such a strong base, and we see some destabilizing maybe elsewhere in the world. We see a global political context that is more. I mean, there's an obvious immediate threat and conflict, General, that you pointed to, but also, there's a change, there's a sort of a transition and a destabilization of an international order that we've all been working within that is now shifting, and we can see shifting for the future. But we start from such a strong base. So I guess my question to us all is, if we come back in another 10 or 20 years, and we're celebrating an ECDC at the heart of an excellent community around public health and resilience across Europe, what will we be celebrating? What will that look like? I'm gonna start with you, Marion. What would be the key elements as we look? Imagine we're 20 years in the future and we're looking back. What will we have got right that will make us say this was a great second 20 years of the ECDC?
Tough one. I think ECDC will have taken in this global praise for the risk assessments, but also have looked at what happens currently at the US CDC and how rapidly that trust is crumbling. But fortunately, Europe set up this task force that looked at all the fake news and tackled it, and this didn't happen in Europe. That's one thing. So that means really action now on what are the mechanisms that are at play there. What do we see? We see elements of it in Europe. How are we actually going to address that? I think that is a key challenge. But 20 years from now, ECDC has managed that with help of all of us. So that would be a very important one. And I think maybe a more expanded ecosystem of collaboration with citizen science, with technologists, with people from very different sciences, and public health, with public health as with a clear mandate on its functions, but with a broader ecosystem. So that, because we need to do it all together. So that's 20 years from now, 10 years from now, where we're gonna.
Well, it's like that's
come.
attention.
A big site with an ecosystem with many different types of sciences, but with a common focus. It is for global health, public health, and there is a convening party that also helps assess and bring all of it together.
So the ECDC as the custodians of having ensured trust, and we had a phrase from this morning which I'm going to steal, which is "make evidence great again," and safeguarding that trust and being part of a broader ecosystem. So you see going beyond public health. So not just, and I'm sure the general will talk about the defense and military side, but you're talking about citizens and other stakeholders in this, if I understand you rightly.
Yeah, so there's a big citizen science. I mean, in the arbovirus world, in the flu world, citizen scientists are doing a lot of the monitoring, and it's fantastic. So they're a great resource and also enthusiastic, and you have a dialogue. So it's also, there's also information exchange. What I think is the core, the diamond that ECDC has is evidence synthesis, but that evidence can come from many different places, many different types of information, and I think broadening of where that evidence comes from and working on evidence synthesis also, for instance, for the social science data, and how do you actually balance that? How do you balance mental health versus overflowing hospitals? Very difficult questions. So the evidence synthesis part of what all these areas of work bring to the table, I think that's really a core role for ECDC.
That trusted focal point that brings it together and tells us what it means. And I love that image for the ECDC for the future. Please, Professor.
Yes, I think also we could use the three words trust, timeliness, and teamwork, as the director used this morning. And I also agree. I think it's in 20 years, I think we can say that ECDC safeguarded the trust in public health by making the right evaluations, making the right decisions, and always making clear communications and science-correct communications clear. And timeliness, I think that will be much of a struggle because we need faster data than we have at the moment to make timely decisions throughout. So I think that's an effort we should focus on, and I think ECDC will play an important role. And then finally, and very importantly, teamwork. I think ECDC is not a massive organization, so working in teamwork with other European organizations, with other organizations more broadly, public and private, and also working very closely with the member states. I think this teamwork will be a key to success, and I'm quite sure they will succeed in that in 20 years.
Thank you. You all know that NATO is famous for its Article 5 and collective approach to defense. An attack against one nation is again attack toward the whole the alliance. So collective defense is really important in NATO. But NATO also have an article called Article 3 that it depends on that each nations are strong enough to be a part of a collective defense. So we should be strong alone, but we are even stronger together. I think we can bring this also into the perspective of to address the threat to public health, both as a part of security, as I'm talking about, but also a part of the coherence within Europe, the trust among nations, and so on. So I think that we have really good opportunity, and we are at a very good starting point. And as you mentioned, that the world is changing, and we don't know what will happen the next 10, 15 years. And I think we need to prepare for a more independent Europe, both in health issues, both in medical logistics, and also to be prepared to deal with difficult situation by ourselves. So, but the nations cannot do that alone. It's too big. So I think I'm really giving up a call out for an increased cooperation and continue the work that ECDC has done for the last 20 years and continuing it to the next 20 years and even have bigger results, because I think that's the only way to deal with these really complex issues that we are facing.
Thank you. I'm sure we'll be celebrating that in 20 years' time. What will it look like from your perspective, Minister?
I think in 20 years' time, we will be celebrating that the ECDC has been even more instrumental in curbing the AMR. We will have binding commitments from the European Union countries that will be overseen by the ECDC, and that will really help us in curbing that, and also using the data provided by the ECDC to get the existing antibiotics and new antibiotics be even more helpful and to work and to have that. And I think that will be a tremendous progress that we will celebrate in 20 years, and we will have been saving the modern healthcare system. Not for good, because antimicrobial resistance is not ever solved, but still we've been curbing it, handling it better than today, and the CDC will be a big part of that.
Thank you. And I think we should all consider ourselves invited to that celebration in 20 years' time. But in the meantime, I would like you to join me in thanking our panelists for a really interesting discussion. Thank you very much, colleagues. Please. So we have a vision for the future, but we also have a contribution this afternoon, but from not one, but two European commissioners. The second one, the European Commissioner for Equality, Preparedness and Crisis Management, Hadja Lahbib, in the form of a video message.
Ladies and gentlemen, dear friends, congratulations on your 20th anniversary. It's a pleasure to speak to you today. 20 years is a real milestone. It's a moment to look back at what we have achieved and to look forward with confidence. Over 2 decades, the ECDC has become a cornerstone of global disease control and central to our European Health Union. You have supported member states in building stronger public health systems through better surveillance, solid risk assessment, and support in putting health policies into action. When the Centre was created in 2005, few could have imagined how profoundly Europe's health landscape would change. From SARS and influenza to Ebola, COVID-19 and Mpox, your expertise and dedication have guided Europe through every new challenge. And with each crisis, we learned, adapt, and grew stronger together. After the COVID pandemic, we entered a new era of European cooperation. The strengthened mandate of the ECDC and the creation of HERA are two pillars of our preparedness union, a Europe that is better equipped, better coordinated, and ready to respond collectively to future emergencies. Dear friends, a key part of this vision is preparedness by design, building preparedness into all EU policies right from the start, and health security is no exception. ECDC's national preparedness assessments under the serious cross-border threats to health regulation play a vital role in setting minimum preparedness requirements. This ensures that every member state can prevent, detect, and respond to future health crises. Our cooperation also extends to operational readiness. The ECDC and the Commission work hand in hand across the full preparedness and response cycle. The EU strategy on medical countermeasures presented in July builds on this partnership. It links ECDC's scientific and epidemic intelligence with HERA's ability to secure timely access to vaccines, medicines, and diagnostics. And we have already seen the results, for example, in our preparedness and response to avian influenza and mpox. Your risk assessments inform HERA's procurement decisions and help turn science into concrete protection for our people. So today, as we celebrate 20 years of the ECDC, we are not only honoring the past, we are looking ahead to the future we are building together. The ECDC will continue to stand at the heart of our Europe's health security as our scientific anchor for disease prevention and control, and as a trusted partner in building a coherent, evidence-based system of preparedness. So, allow me to end with a simple message of gratitude and confidence. Thank you for your dedication, your expertise, and your service to Europe. And I look forward to working with you to make Europe stronger, safer, and healthier for all of us. Thank you.
So after those messages of marking the anniversary of the ECDC, everything that's been achieved, and all the hopes and ambitions for the future, Pamela, may I invite you to come up and give us your closing thoughts at the end of this impressive afternoon?
Indeed. Really impressive. We're almost done. This was such an interesting panel discussion. I'm so happy and delighted. And I have to say what I said after our meeting, the joint strategic meeting this morning, when we met and discussed future needs and challenges. What I felt here as ECDC and ECDC director was I felt the trust from these different perspectives made by science, the public health, even the military side and politics, the member states, into the work of ECDC. And this is for us the biggest birthday gift you can give us. Because this makes us strong as an institution, as an independent scientific European public health institution for the future work. And I'm so happy to have received, as all of you today, listening to all these perspectives, why it is so important to invest in public health. We got the bigger picture. It's more than just talking about viruses or bacteria, resistances, because health is much more than the absence of a disease. It's a matter of security. It's a matter of resilient societies. It's a matter of democracy. it's much, much more. It's a matter of stable economies because it needs healthy workforce. And all this matters when it comes to the question of relevance and importance of public health. So I think I felt this so much now, hearing and listening to all of you. So let me thank you to the panelists from here for your very open minded discussion, perspectives and ideas you gave to us, to all of us, for the future. When I'm saying, well, I want also to stress and summarize it from my point of view, and it's very much in parallel what we discussed this morning with the member states regarding the future. It's about more collaboration, cooperation, definitely. It's about more independence, especially in the light of the ongoing geopolitical shifts, European independence when it comes to medicines, but supplies, but also when it comes to scientific evidence. We need more independence that we learn right now. And so we have to scale up, all of us. And it needs more innovation. And as the minister says, unlock not only the innovation and the data, let's unlock the optimism. Let's unlock our excitement. And I'm so happy that Marion Koopmans mentioned that it's exciting. It's really exciting, really to see this phase of transformation. It shouldn't scare us. It shouldn't frighten us. It shouldn't make us really scared to be scared of the future. No, it's a phase of transition, but it's a phase of opportunities, new opportunities. And we are all here today to pick up these opportunities and to use it for better public health in Europe. I can say for ECDC, we will, of course, proudly continue to work tirelessly alongside the Commission, alongside the member states, alongside the scientists of Europe, our partner agencies, like some of them here today, European public health agencies. And because we can only do this together, we can only build the future of public health in Europe together. And when I'm saying thank you, I want also to say one big thank you to the organizing ECDC committee of this very special celebration event, especially to the project manager, Evelina Iden. You did such a great job, Evelina. You jumped in 6 months ago. Yeah, I remember when we asked you, I think it didn't take you 2 seconds to say yes. I love that. Just spontaneously taking new challenges, and you jumped in, and you were never tired, you were never complaining, you were so professional. Thanks so much for making this happen. But thanks also to all the other colleagues at ECDC, the volunteers who supported, from finance to audiovisuals, facility management. I hope I don't forget communication, and all the others who have really made this event an unforgettable event for us at ECDC, and I hope also for our guests from abroad and our friends here who were celebrating with us. I want you to invite to take this positive perspective we got right now and the hope we just felt right now, to take this out, to celebrate today, and just continue working together, hoping that the future together is a better future. Well, actually, we don't need to hope, for sure. Together, we are stronger. Thank you very much.